Hello, folks. My name is Alex Singleton, CTO, CEO, and founder of Bucephalus Development, headquartered right here in Kansas City. And I'm working on a graduate research project with at Hillary Tran and Dr. Steve Hardy at George Washington. The concept is called HealthCoin, a blockchain-powered database system for electronic medical records. Hillary, if you'd like to introduce yourself. And Steve.
Hi, I'm Hillary. I'm currently working with the DoD and I'm local to the Washington area.
Hello, my name is Stephen Hardy and I'm a board certified emergency physician working in Allentown, Pennsylvania.
I'm going to go ahead and kick us off here with the first slide. Why do we still wait for paperwork in the age of the iPhone? Many of us have been to the doctor's office or ER, and sometimes there are waits, sometimes there are not. Has nothing to do with the doctor per se, but the actual system itself. And we aim to address that by taking a look at the electronic medical record. Let's start with a few questions here. Who are you, and how many times a year have you visited the doctor in the last 5 years? And do you even have possession of these electronic medical records? When every time you go to a visit, you create a new record. Do you have access to that record? And why not? It would seem like you could have that if it's your data. And again, since it's officially over a decade since the birth of the iPhone, I wonder why so many of America's best doctors and nurses are still burdened by the amount of paperwork in their offices today. In fact, it's so bad, I've heard some doctors say that they would take a pay cut in exchange for reduced paperwork. I don't know if Steve maybe wants to confirm that for me or not, but maybe not. But anyway, having said that, let's go on to talk more about why we'd like to reduce paperwork. With a blockchain protocol, HealthCoin could be a new system or a new electronic medical record that's conceivably akin to a open source database, a ledger of contracts, instead of scattering multiple electronic medical records between facilities and visits. And again, just to remind you what blockchain is, it's the underlying protocol powering the Bitcoin network, which is, again, a decentralized network of computers recording and authenticating financial transactions without relying on a central authority. A publicly available relational database management system secured by the same cryptographic hashing of private and public keys under the hood of today's email by simple mail transfer protocol. So if there is an open source system like that is protecting anonymous transactions, how is that different from a transaction of data at the doctor's office? And let's talk more about that. What our mission is. Our mission is to create a groundbreaking new electronic medical record system, a paradigm in which healthcare data may be exchanged utilizing the same underlying blockchain protocol powering Bitcoin as the potential viable open source alternative for high transaction application volumes. So not only could this network, this open source network, store patient data, it could conceivably store and interact with insurance data or insurance payments, and also what smart devices or wearables like for fitness, and how that could actually help in monitoring or tracking patient health. I'm going to go ahead and lead this off to Steve now.
Thanks, Alex. Okay, so our requirements gathering consisted of mainly utilizing the survey method and following up. We asked our contacts about their understanding of our proposed solution of the registration and triage system in the hospitals, specifically in emergency departments. There were two separate surveys, one for general users to represent patients, and one for medical personnel to represent the doctor and the nurse. We ended up choosing three figures to answer three key questions. The first question was, do patients have a smartphone? Second question was, do patients want a digital healthcare experience? And the third question was, are medical personnel satisfied with their current state of the electronic medical record? Here is a pie chart from the user survey to answer our first question. Do patients have smartphones? The overwhelming majority of users have a smartphone, over 90%. This is compared to a national average of about 75% in the US, according to a recent Pew study. Smartphones are being used increasingly, not just for phone calls, but also for non-traditional purposes, like finding a date, holiday shopping, or reading a book. Also, a growing number of Americans, especially those who are in lower income, may rely entirely on their smartphone for access to the internet. For those without internet or smartphones, we suggest providing adequate alternatives for this concept business plan, such as iPad kiosks in the waiting room of your clinic or emergency department to serve those without phones. Next slide. Again, this is from our user survey. It's another pie chart to answer the question, do patients want a digital healthcare experience? The number of patients who want to digitize this process is significant. We're in the midst of a healthcare revolution. And with the physician reimbursement transitioning from a fee-for-service model to a value-based model, this is the direction our health data management must progress. Next slide. Last, this is from our medical personnel survey to answer question 3. Are medical personnel satisfied with the current state of the EMR? This bar graph shows that few are dissatisfied with the EMR. This means that there's room for innovation. There's interest in patients retaking their medical data and owning it. Right now, this is in the form of paper copy of their records. Why not extend that concept to their own digital files? This would propel the concept of a smart health record. A record where the content travels with the patient instead of being buried in the paper record, especially when visiting another state, another hospital, and another institution. Next is Hillary, who will speak about our use case diagrams.
So we separated the use case diagrams into 2 separate processes. The first one you see here, which is the registration and triage system. This is to reflect from the patient's perspective their initial transaction, which is to register for an appointment with the emergency department, record their information, and any primary examination and medical details. In this process, the patient signs in at the emergency department front desk, which entails that the administrative personnel pulls their medical history, as does the triage nurse. By signing in for an appointment, that also means demographic and patient data is also collected by the registration associate. If there's a long waiting line of patients, then the patient may be taken to the waiting room by the registration associate. If not, the triage nurse conducts an emergency screen exam on the patient, which includes assigning an ESI level and placing them in the proper waiting area before being examined by a doctor. Next slide. So this slide depicts the medical treatment system, and this second transaction takes place when they're with the medical personnel and have received their diagnosis and subsequent treatment. In this process, the doctor meets the patient in the examination room and thusly conducts an examination. The patient receives a diagnosis and the doctor fills out the patient medical record accordingly. When examining the patient, the doctor may want to order any additional x-rays or CT scans for further examination. After the appointment, the patient must pay for the treatment. This will either be done by the patient or their insurance. During this process, the patient or insurer may request copies of the medical record. Next slide. Alex will be talking us through the class diagram.
Thank you, Hillary. And we're going to go ahead and take a look at the class diagram here. You can see the relationship, how this is actually architected or how we went about in our approach. The approach is exactly or almost identical to how one would register a digital wallet with a cryptocurrency exchange, or account. You can see that all the entities related here, all of the entities related in this relationship, it starts with the patient, the actual HealthCoin wallet, the digital wallet, the hospital, the electronic medical record itself. Oops, my slides are kicking around here. Just one second. The electronic medical record itself, the healthcare insurance provider, the doctor, department, and nurse. And typically how any sort of care is administered, how it starts, it seems to always start with the record. The patient enters the office, they end up registering their information with the office. That in turn gets transcribed onto some sort of record. And from that point on, the care happens through that record. So at the end of the day, that patient is being treated through the record or managed through that record. The hospital manages that record through the actual electronic medical record. And I'll pull up another file here to zoom in on these entities to show exactly what attributes are here. Bear with me 1 second while I pull this up. A little bit of technical difficulties there. Let me pull that up. Here we go. And if you can see the screen here, we'll zoom in. You can see how these relationships, again, are related. We have a HealthCoin digital wallet that contains a private key, and that private key, or patient ID, is the new universal patient ID. That wallet has a public key. So that composite key relationship between the patient entity and the digital wallet entity is what builds or instantiates the new electronic medical record. From that point on, again, you can see the relationship here. That private and public key create that transaction to create a new record. We have a history here as well. That's another attribute: diagnosis, medication, and balance. That again comes from the healthcare insurance provider, how that would relate to that instance created for that record or event at the hospital. We then look at the hospital, how again that's related or managing that record, or how it is managed through departments. We take a closer look here. There is the department entity, and the two entities there that are related to the department are the doctor, of course, and the nurse. Cardinality here is also respectively displayed, and yeah, that's exactly, it's pretty simple how a healthcare visit could work. Let me pull back to the slides here. And again, you can see the relationship here. Now let's take a look at the actual login view, or view what would happen upon registering a HealthCoin account. You would see a patient view and a doctor view. Ideally, that's exactly how the visit would work. The patient would register their account. After they'd register their account with their digital wallet, which we'll walk through on a mock-up or a live demonstration shortly here, the patient would then see their dashboard. They have a few options. Go to their digital wallet for other API connectivity or interaction, say like through a wearable or maybe a healthcare insurance account for payments. They could also monitor their health and their history of visits. After that, we would then see what a doctor view looks like. Very similar. They have a patient pipeline within their charts. They have their own dashboard. They have a patient history for themselves, the patients they have currently they're treating, and then their schedule. That's how the HealthCoin account would work for a doctor. And Steve, who is our doctor here, our resident doctor, is going to be taking a closer look at what the app will look like to a doctor.
Thanks, Alex. So this is a screen of our mock-up demonstrating the triage nurse and patient interaction. So it should be emphasized that this is the first medical assessment that occurs when the patient enters the emergency department. They're going to interact with the registration associate, or they may interact with the iPad kiosk. But their first medical assessment is going to be when they're called back for their medical screening exam that's initiated by the nurse in triage. HealthCoin will provide an interactive triage report form for the nurse to carry out this assessment. By selecting on the relevant medical screening exam, different systems will be shown. For example, here is shown the skin integumentary system of a medical screening exam. These are very specific and thorough assessment forms. And when the nurse fills these out, it helps triage the pertinent positive and negative clinical exam findings for the physician. Due to patient privacy concerns and federal law, nurses and doctors will have to have specific user IDs, and it will require login for each chart they document. The user ID is represented by the face icon on the top left of the iPad screen layout. This is the first icon on our vertical toolbar. Login can be easily done with keycard registration, as is currently used with Epic and Cerner EMR systems. Now let's work our way down that vertical toolbar on the left. Home, which is the shape of a house, will take medical personnel back to their home screen. Briefcase icon shows the workload that's currently open. This is the number of unlocked charts, and it's going to demonstrate it in a report format. Pencil function serves as extra annotation required for visual diagnosis and description, as well as for a notepad function. And you could maybe write some hand sticky notes or even a quick prescription. Data link can be used to link the external files from a previously collected visit. It's essentially raw HealthCoin data that might have come from another hospital system or another state that the patient's carrying on them and presents at their initial medical screening exam. Locked status locks the patient chart. Settings cogwheel is used for individual healthcare provider macro creations, user preferences, color schema, text and font size personalization. Next slide. After triage by nursing, patients are going to be led back to the emergency department room, or they're going to be placed in the waiting room queue. Some emergency departments employ a walking wounded section where after nurse triage, if you're a lower acuity patient, you might go to a upright medical chair. Either way, if there's no open emergency department beds at that time, there's going to be a time gap from when the triage nurse makes their assessment to when the doctor-patient interaction occurs. This is a high liability time period and paramount to patient satisfaction and safety. This metric is also called the door to provider time. It's directly related to the left without being seen time. This is another metric that we use to judge how well an emergency department is doing. Ultimately, these metrics comprise an overall beginning to end time. That's called the length of stay. Utilizing portal mobile technology to capture private patient data is the solution to decreasing wait room times, emergency department efficiency, and ultimately patient safety. The now soon-to-be geriatric population of baby boomers are becoming more and more complex. They take up the few precious remaining hospital beds, and they increase to overall emergency department overcrowding. Hillary's going to take it from here to walk through the records request portion of our prototype.
So the records request function in HealthCoin acts as an interface that should reflect typical information consent forms to disclose to transmit their PHI, protected health information. Using HealthCoin, patients are able to navigate to their homepage, contact hospital personnel when met with confusion, and view their past visit histories. On the Records tab, users can see previous requested records, request a record, and review the progress of pending requests. If a patient wants to request a record from a recent visit, they'll be able to access a form in which they will select the date of visit, confirm their identity and the facility visited and to whom they wish to send the record. Lastly, they'll give their consent to releasing this information to them and submit that form. By using this function in HealthCoin, users and hospitals are able to reduce red tape and minimize the artificial layers of bureaucracy needed to request and release patient medical forms. Next slide. So what you see here is the billing post-examination side of HealthCoin. Using HealthCoin, patients and hospitals are able to have a centralized database and/or location that will aid in insurance verification and medical bill issuance. HealthCoin provides ease of navigation in which the user can easily move between tabs to go back to their normal homepage, look at previous invoices, and contact personnel if there's confusion about those invoices. The hospital is able to connect with the patient and provide them with their most updated invoice in the current invoices tab. There, the patient will be able to view the medical invoice, which should reflect the account summary, services provided, information about their coverage, which have been verified, and respective total amounts. From here, the patient will be able to either make the payment if they pay out of pocket or forward the invoice to their insurer. Next slide, Alex is going to walk us through the demo.
Thank you, Hillary, and I'm going to go ahead and walk you through a demo hosted here via mockups. While I pull this up here, bear with me. Okay, again, we return back to that patient login view. This is the login view after, or what you would expect after a patient registered with their, I guess, HealthCoin wallet. Let me go ahead and take you to the prompt that would happen when you actually connect the digital device or wallet to the iPhone upon the initial registration. The sync would exactly replicate or resemble a digital wallet registration for a cryptocurrency. So I would go to digital wallet here. And again, I would already be prompted to this view upon the initial install. So what I would do is I would connect the wallet or device to the iPhone once to pair the private key and public key. And then once doing that, we would connect it. The smartphone application would register that private key with the new public key account with HealthCoin. We hit OK. And then it's connected. That's the acknowledge and the notification here. The next step would be to pick a 4-digit number, just like you would in accessing, again, a digital wallet with a cryptocurrency. You would pick a 4-digit passcode. According to the wheel or the layout, how it would be displayed here, it would probably be interchanged for the sake of information security. Upon entering that in and selecting OK, you'd be requested to confirm that PIN one more time, then hit OK, and then there would be a successful acknowledgement of the registration with the private ID within the device digital wallet, that private ID, and the public ID that would interact with the HealthCoin blockchain from here. So the idea would be to use this app as if it were almost like a Starbucks app. Every time you would go to the doctor or hospital, you'd be collecting your data through here, and then you would again sync all of your data back to a digital wallet-like device, like you would again offline on cold storage with a private key. A transaction offline from another cryptocurrency exchange. So anyway, that's the idea of it, and I believe that concludes our presentation. If anyone else has any questions, I would ask them to go ahead and Google me or anyone else within this presentation. I'm going to be blogging about it and posting this video up later. We had a great time with this project, and I don't know if Hillary or Steve wants to say anything else, but I'll go ahead and leave it to them. And we'll go ahead and conclude.
Thanks.
Thanks, everyone.